So what is implant rupture? So implant rupture refers to when the implant shell has a rupture or crack in it. So if that happens to a saline implant, you'll know it because you're gonna get a flat tire, meaning the saline's gonna leak out, your body's going to absorb it, you're gonna pee it out, and your breast is going to go flat. And then you're basically left with an empty Ziploc bag in your breast until you have it fixed. If a silicone implant ruptures, that doesn't happen because the silicone gel inside the shell, which ruptures, does not get absorbed by your body. It stays inside that capsule until surgery is done to fix it. Oftentimes, a silicone implant will be ruptured and you won't even know because the new silicone gel doesn't really leak out like old silicone gel. So take the silicone implant here and I'm gonna cut a hole in it. See if I can do it on camera here. All right, so I'm gonna cut a hole. There we go. I just cut a hole in it. So this is it, and you can see that it's not like pouring out. It just stays there because it's like a gummy bear. So I cut the shell, so I ruptured this shell, and it just kind of hangs out there. It's not like a liquid. So that is rupture of a silicone shell in a silicone gel implant. And that happens at a rate of 1% per year. Meaning the longer the implants are in, the more likely it is that they have a rupture. Now, it's not like someone's gonna cut it with a scissors like that, but that is the rate that the implant companies cite, is that the implants on their own over time will rupture at a rate of 1% per year. Now, the FDA wants we plastic surgeons, to recommend that patients have an MRI done after 3 years and then every other year to monitor for implant rupture. I personally don't agree with that. Most of the plastic surgeons I know and were trained by don't agree with that. If there's a problem or we are worried about something, we're either gonna do surgery anyways, so the MRI is an unnecessary expense, or if an MRI would prevent surgery, we'll get the MRI if it's gonna change what we do. So I prefer to order MRIs and do tests only if it's going to help us solve a problem and answer a question. I do not think it is worth subjecting people to really expensive MRI screening tests after 3 years and then every other year to look for something that really isn't a problem. I mean, I'm not going to say this isn't a problem that doesn't eventually need to be fixed, but it's not like this is going to cause any harm in the short term. And before it starts to cause any irreversible harm, there will be signs and symptoms of a problem that will lead to an evaluation. So, I mean, I cut this thing and it's still hanging out there. Like, it is cohesive. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.